Today we are going to discuss about heart failure. What is the function of heart? It is to pump blood to meet the demands of our body. So when heart fails to pump blood to meet the demands of our body, it is when you call it as heart failure. So what are the risk factors for heart failure? To remember this, there is a mnemonic heart failure where H stands for hypertension, E for endocarditis, A for alcohol, R for rheumatic heart disease, T for thyrotoxicosis, F for family history, A for arrhythmias, I for infection or infarction, L for lung diseases, U for uncontrolled diabetes mellitus, R for renal diseases, and E for excess salt intake. What are the types of heart failure? We have high output or low output heart failure, left ventricular, right ventricular or biventricular failure, systolic or diastolic failure, forward or backward failure, acute or chronic heart failure. First we will discuss about high output and low output heart failure. So what is high output heart failure? Normally to meet the demands of our body, cardiac output of 5 liters per minute is sufficient to meet the demands. But when the demands of your body is going to increase to a greater extent, then this cardiac output also tries to increase so that the demands are met. But even with increase in cardiac output, when the demands are not met, then it is called as high output heart failure. You can see these conditions in thyrotoxicosis and in severe anemia, where in thyrotoxicosis, you're going to have increase in the metabolic needs of the body, which is not met even with increase in cardiac output. In severe anemia, the oxygen carrying capacity is very much less, but even to meet that increase in cardiac output is not sufficient. Then this is called as high output heart failure. What is low output heart failure? In low output heart failure, basically you have, even to meet the basic needs of your body, your heart is unable to give the sufficient cardiac output. So to learn this, you need to know about the basic physiology. Cardiac output is given by your heart rate into stroke volume. So when your heart rate is going to be increased or decreased, both in bradyarrhythmias and in your tachyarrhythmias, your cardiac output is going to decrease. Now how in stroke volume it is going to be altered? Stroke volume basically is determined by your myocardial contractility, preload and afterload. Myocardial contractility is the ability of your heart to pump blood. It is to contract. Preload. Preload is mainly given by your end diastolic volume. So afterload, it is mainly given by your resistance. So what is preload? The initial length of the muscle before it contracts is going to determine the force of contraction. Afterload, the resistance against which your heart has to pump blood is determined by afterload. So how do we understand this? Let us suppose that there is a person who needs to take books and climb the stairs and keep it in the shelf. Now for example, with this person, the health of the person is taken as myocardial contractility. Only if the person is healthy enough, he can do the work. So therefore, health of the person is taken as myocardial contractility. Now whatever the number of books he has to carry is taken as preload, and whatever stairs, the pathway he has to use is taken as afterload. So first we will discuss about myocardial contractility. Now whenever the health of the person is going to be good, the performance is going to be good. Whenever the health is going to be less, then obviously contractility is going to be less. So whichever condition is going to affect your myocardial contractility is going to cause reduction in cardiac output. So what are the conditions which can damage your myocardium? Say for example, your ischemic heart disease, your myocardial infarction. So it affects the ventricles. So therefore you can have reduction in the cardiac output. Now while we discuss about preload, basically you need to know one part, which is whenever the preload is going to increase To certain limit, there will be increase in force of contraction. But after a certain limit, the cardiac output decreases. Say for example, I increase 3 books to 5 books. Yes, the performance is better. I am getting enough books in the shelf. But together I give 50 books and I ask the person to carry. Then obviously the performance is going to reduce because the person cannot tolerate. So which is called as, or which is explained by your Frank-Starling law. Your Frank-Starling law states that the force of contraction is dependent on the initial length of the muscle fiber. So if suppose I am going to take end diastolic volume on the x-axis and cardiac output on the y-axis, whenever the end diastolic volume is going to increase, cardiac output increases up to physiological limits. But after that, this is going to cause a decrease. Why? This is explained by Laplace law. So what does your Laplace law states is, now whenever you have the heart which is going to be, let us suppose this is your ventricle. Now this ventricles will have the tension on the wall. So the wall is the one which is going to generate the tension. So inside it is going to be your radius, and this is going to give the pressure which is sufficient to pump the blood into the systemic vessels. Now when the ventricles keep on stretching, what happens to the radius? It increases. Laplace law states that your pressure is equal to T by R, where T stands for tension and R stands for radius. So whenever your radius increases, your pressure is going to decrease. And when pressure decreases, it is not sufficient to overcome the resistance in the vessels, in the systemic vessels. So therefore the cardiac output reduces. So that is why when preload increases to greater extent, your cardiac output reduces. How about afterload? If suppose I ask the person to use a very narrow path, or I make the path very steeper, the person will find very difficult to do the performance. So therefore, whenever there is going to be increase in afterload, the cardiac output decreases. And I told you afterload is nothing but the resistance. So whenever resistance increases, a cardiac output decreases. The next type of failure we are going to discuss is left or right or biventricular failure. Left ventricular failure is also called as left heart failure. Now in this schematic diagram, let us suppose that this is the right side of your heart and this is your left side of your heart. Now in a condition where your left ventricular is failed to pump enough blood, so what happens? The amount of blood that is remaining in the ventricle is going to increase, which is your end diastolic volume. So it is going to increase. So when your end diastolic volume is increasing, the pressure is also going to increase. Now your atria should pump blood against this increase in pressure in ventricles. So therefore, this is also going to cause your atria to work very hard, and the pressure in the atria is also going to increase. Now when this pressure is increased, it is also reflected in your pulmonary veins, so where the pressure is going to increase, which is again reflected onto the pulmonary capillaries, where the pressure is going to increase. Now whenever the capillary pressure is going to increase, there is increase in your hydrostatic pressure. And when there is increase in hydrostatic pressure, you know it results in edema. So therefore, you have the exudation of fluid into the alveoli, into the lungs. So therefore, this results in pulmonary edema. Now what happens is, with this fluid in the lungs, your lungs will find very hard to work for breathing against this fluid. So therefore, the work of breathing is going to increase with pulmonary edema. So because of which the person can have dyspnea. Now this increase in pressure is going to be more if the person is going to lie down, and therefore the person can have orthopnea and paroxysmal nocturnal dyspnea, where they will find increase in breathlessness in lying down position. If this edema is also going to occur on the bronchial wall, it is going to result in cough in the subjects, which is called as cardiac cough. So for the patient with pulmonary edema, if I'm going to do the RS examination on auscultation, I can hear crackles. I can hear crackles. So these are the features with your left heart failure. So now we are going to discuss about right heart failure or your right ventricular failure. So now I told you that this part is taken as your right side and this is your left side. Now getting an isolated right heart failure is quite rare. Most of the time it is a complication of your left heart failure. So this increase in pressure is going to be reflected to your right ventricle, then to your right atrium and so on. Sometimes secondary to pulmonary artery hypertension, you can get this right heart failure, which we will be discussing in cor pulmonale. So now let us suppose that the right ventricle is not pumping enough blood. So what happens over here, the volume is going to increase and the pressure is going to increase, which will be reflected in your right atrium. So this right atrial pressure is going to increase, which will be reflected in your vena cava, your superior and also your inferior vena cava. And you know, this is where you have your jugular vein. So therefore this is going to be reflected in your JVP. So therefore there is increase in JVP. Now this is going to be reflected in your inferior vena cava, and you know liver is going to drain through your hepatic vein over here by receiving the blood from the GIT and also from the spleen. It is going to drain into your inferior vena cava. So whenever you're going to have this increase in pressure in inferior vena cava, it is going to be reflected into your hepatic vein, into your livers, into your GIT, into your spleen, and again this will be into your capillaries and this will be into your other systemic arteries and so on. Right? So when there is going to be this congestion of liver, it can result in the hepatomegaly. And sometimes it can also cause ascites. So that is why person can have right upper quadrant pain. And whenever it is going to be in your GIT, so the bowel wall gets edematous. So the person can have abdominal discomfort or fullness can be present. And because it is also present in the spleen, the person can have the enlarged spleen, splenomegaly. So the person can have splenomegaly. And when it is going to be into the entire systemic vessels, it can also cause edema. So there can be peripheral edema. So these are the features in a person with right heart failure. Now when we talk about biventricular failure, it is where you have the entire congestion of the entire vessels. So that is called as congestive cardiac failure. So how to remember these three? So left heart failure affects lungs, right heart failure affects your GI organs, and your biventricular failure is the total congestion. So remember, left is for lungs and right is for rest of the body, and biventricular is your total. The next type of heart failure we are going to discuss is systolic dysfunction and diastolic dysfunction. In systolic dysfunction, the ejection fraction is going to be less than 40%. In diastolic dysfunction, the ejection fraction is going to be more than 40%. So in systolic dysfunction, it is unable to pump. In diastolic dysfunction, it is unable to relax. So here the problem is with pumping and here the problem is with relaxing. So what happens is, in systolic dysfunction, if suppose it is unable to pump, then the amount of blood that is going to remain over here is going to increase. So therefore the end diastolic volume is going to increase and the pressure is also going to increase. Right? So now you already have more blood in the ventricles and your atrium is continuing to empty it. So therefore your ventricles is getting overfilled. So because of overfilled ventricles, because of this overfilling, you hear a sound called as S3. So S3 is common with your systolic dysfunction. Now when we talk about diastolic dysfunction, the heart is failing to relax. So when it fails to relax, the amount of the end diastolic volume is going to decrease. But the pressure is going to increase because this non-compliant, it's failing to relax. So therefore the pressure is going to be little high. So when this pressure increases, your atria is trying to pump the blood into the ventricles, which has got increased in the pressure. So because the atrial pressure is also going to increase to empty into the ventricles with increase in pressure, it produces a sound which is called as S4. So this is the difference between your systolic and diastolic dysfunction. The next one is your backward failure and your forward failure. Forward failure is very easy to understand, which is nothing but because of your reduction in the cardiac output, there is a reduced perfusion of all your organs. So it is called as forward failure. Now when we talk about backward failure is where we discussed that with right heart failure, the pressure in your veins, in your liver and all that is going to increase. And whereas in your left heart failure, the pressure in your atrium, in the pulmonary vessels is going to increase. So this type of failure is your backward failure, where from ventricles it is reflected into atria and then into the vessels and so on. What is acute and chronic heart failure? Acute heart failure, patients present to you with symptoms of acute pulmonary edema. Say for example, the person has got an extensive MI. So there is going to be damage of the extensive part of your ventricles. And sometimes this MI is great to an extent that it also damages the septum in your ventricle. So it damages the interventricular septum. So in all these conditions, you can have acute pulmonary edema. And let us suppose that you have your aorta and you know that the valve in the aorta is going to be your aortic valve. If there is going to be infective endocarditis and it is going to damage your aortic valve, you can have aortic regurgitation. So all these conditions can cause acute heart failure. Chronic heart failure is where a person with long-standing hypertension or with ischemic heart disease, they develop failure. It is called as chronic heart failure.